Hi everyone, welcome to tonight's webinar, CBT for ADHD, Manage Adult ADHD with Leading Edge Group Therapy. My name is Zoe Kessler and I'll be your host for this evening on behalf of PsychCentral.com. Before we introduce tonight's presenter, I'd like to remind you that you'll be able to access the complete webinar online at Psych Central's YouTube channel later this week. And tonight's session, we're going to do it a little differently than we usually do. We're going to give you two opportunities to ask questions. So as we go, I'm going to ask that everyone here with us tonight, please type your questions in the question panel. So I hope you can see the little area where you just click in and type your question, and I'll be fielding those for you. So what we'll do is we'll have our presenter present for about 20 minutes, then we'll have a very short Q&A on what's been spoken about until that point. Then we're going to continue, and when the presentation concludes, we'll use the rest of our time together to answer any further questions you might have for Alina. Now we'll try to get to everyone's questions, but of course we'll also do our very best to wrap up within an hour. So I'll tell you a bit about tonight's presenter. Alina Kislenko is a therapist in private practice specializing in ADHD, Asperger's, sex therapy, and couples issues. Alina's been running support groups for people with ADHD and Asperger's for the last 4 years, and she also hosts the Strange Brains talk show on the radio, and I've been a guest at that show, and I just think it's terrific what she does, and I know Alina has archives of all her past shows as well. And the show focuses on exploring strategies for people with ADHD and Asperger's. Alina's professional expertise is enhanced by her personal experience. She's been diagnosed with ADHD and mild Asperger's syndrome herself, and she strives, probably because of that, to inject humor and warmth into her work. And I can tell you, she doesn't just strive, she succeeds. I've been to her groups, and I've met her, of course, and she's wonderful, and I'm so happy to have her with us here tonight. She's a group facilitator, and she's also a productivity coach. So enough about with me talking. Let's get on to the presentation. Hi, Alina. Welcome.
Hi, Zoe. It's so nice to be here.
I'm really thankful that you did devote your hour to us tonight. And so what I'm going to do while I'm speaking is I'm going to turn the reins over to you, and we'll get started with the first part of your presentation, and I know you'll verbally cue us when you're ready to take a little break and see if there are any questions, okay?
Awesome. Yes. Thank you.
That's great. And I'll remind our listeners as well to please just feel free to go ahead. Feel free and go ahead and ask questions in the question box. Lena, is my voice okay right now?
Yep.
Loud
Yeah,
enough?
fantastic.
Oh,
and I
good.
feel very free after it's been repeated 2 times. I'm like, oh, I'm so free. Wait, I have to do a presentation. Yeah.
All right. I'm going to mute myself and off we go.
All right, great. So hopefully everyone can see my screen. And so the presentation's about my group that I've been running for, well, there's been 2 groups I've run. One has been almost 4 years, and another one I started about a year ago, which is CBT for ADD, versus the other one was a support group, and I'll just change slides. So the 2 groups are a little bit different. So I've been running the longest group, the support group for adults with ADD. I ran it for a little while, and then I started noticing that, you know, there just weren't enough pieces there, and that there were, like, I kind of used to run it really kind of loosey-goosey and see what happened, and sometimes we ran for, you know, 2 hours, ignore that, and sometimes we ran for 4 hours, really, whenever the heck people wanted to go home. So after a little while, I realized that actually we had to create a little bit of a kind of streamlining, and we started kind of changing the format of the groups and getting it to the point where people were able to really get a lot out of it, as well as come and have that camaraderie feeling. So over the years, it eventually morphed, so it's still there, but another one came along out of it, so the Cognitive Behavioral Therapy group. The biggest difference here between the support and therapy group I've been running is that we have a homework component, so every week between sessions, everyone kind of chooses one goal for next week, and then we just check in, how did you do? I'll usually ask, you know, what percentage of your goal did you get done, like 20%, 30%, 40%, 100%, whatever. And that's awesome. We just help scaffold them to new goals because that's a big problem people with ADD tend to have. And also we tend to vote on topics in the CBT group, so depending on who comes in, because it's actually a drop-in group the way that I've been running it. And yeah, and then we also have a couple other parts where I teach techniques and a lot of things. So I'll talk a bit more about it as we go. So first of all, what is CBT? So it's cognitive behavioral therapy. It's predominantly made out of two things. So it's monitoring and changing our thoughts, and it's also monitoring and changing our behaviors. These are quite different because thoughts are more like what you're thinking, what kind of things are happening in your head that nobody knows about, so in the black box. And monitoring and changing, so our behaviors is more about like what are we doing, what do people see us doing on the outside, what are the actions we're taking. So first I'll look at, in CBT there's monitoring and changing thoughts. So first we need to be, in order to do that, we need to notice cognitive distortions and negative self-thought. So that's the noticing and monitoring the thoughts. So, and then there's the determining new self-talk we'd rather have. And so just to explain what I mean by noticing the thoughts, here's an example of several cognitive distortions. So cognitive distortions are extraordinarily important in cognitive behavioral therapy, but are especially important for people with ADD. And this is just because we tend to, don't mind that, it'll pop back up in a second. We tend to encounter a lot more thinking issues than most people do, mostly because the way that we have been kind of grown up, we always realized we were a bit different. And so everyone already, when they become wrong about something, or they're confused or emotionally dysregulated, they might create lies in their head or create shortcuts to help them, especially as you're a child, to soothe yourself. And with ADD, we tended to have more trauma or more confusion to soothe ourselves from. So in turn, our cognitive distortions or our negative self-talk takes on like monstrously humongous kind of proportions. And as I have ADD myself, I definitely experienced these myself. So as I started learning about this in my own many years of personal counseling, I was going to a therapist before I became one, these things were ridiculously important. We talk a lot about these in the CBT for ADD group. So I'll just outline a couple of like what we're seeing here. A really common one is all or nothing thinking. That's number one here on this slide. So that means you see things in black and white categories. So if your performance falls short of perfect, you see yourself as a total failure. Or if you did great, you're a total success, or it could just be like, wow, I didn't get that job. It must be because like I'm no good at this profession, period. So that kind of thing is really common with people with ADD. They just decide, you know what, I'm useless. And another word for that is learned helplessness, where you eventually start going like, well, why would I even try anything? I obviously suck. And I had a lot of that I had to get through myself. And then to scaffold kind of thoughts like, instead of, oh no, the whole world is against me, we're trying to change things into the, okay, what do I do to change the world to suit my needs versus, or to change my interpretation or what I'm sending out into the world to change what's coming back. Another common cognitive distortion is overgeneralization. And this one is huge because and it's a huge one that contributes to depression, which is also really common in ADD. This is when you see a single negative event as part of a never-ending pattern of defeat. So it's like, oh, I didn't get that job one time. I will never, ever get any job I apply to. It's almost like a sort of superstitious thinking. So these are just a couple of examples of what we tend to target within the group. And just something that isn't on the slide, but I really want to bring up is it's from the book Cognitive Behavioral Therapy for Adult ADD by J. Russell Ramsey and Anthony L. Rothstein. It's a really great book. It's called An Integrative, so it's Cognitive Behavioral Therapy for Adult ADD, An Integrative Psychosocial and Medical Approach. And this book is all about running groups for people with ADD, particularly CBT for ADD groups, and I'll be talking about some of the research in this field pretty soon. But some of the other things, as well as cognitive distortions, that people with ADD really need to watch out for is anticipatory avoidance / procrastination. This is a big thing we target in the group. So what it is it makes it difficult to kind of see a task that's coming along. Realistically, we think, oh my God, I have to do something. It's probably going to be bad. It's probably going to go badly. Or another thing we tend to do as people with ADD is we tend to juggle. So we take on more and more projects, and we're really not taking care of our last projects, et cetera, et cetera. There's a lot of skills we have to gain for that. A lot of them are targeted in the CBT for ADD group. Okay, so now we talked about some of the negative things kind of we're doing to ourselves. So negative self-talk, like, you know, the always never thinking, or the thinking that something will last forever if it goes badly. Now here are some examples of healthy self-talk. So a negative talk example is, I'm such a loser. The healthy talk alternative, and I know the urge to use this isn't always that high and can be a difficult thing to conjure up, but the healthy talk could be something like, okay, I'm not fantastic at this social interaction or social interactions yet, but, you know, I'm a lot better than I used to be. Or a negative self-talk pattern like, oh my God, I'll never get this right. By the way, like, which will, when we have these negative self-talk patterns, what tends to happen is our cortisol, our main stress hormone, tends to rise as a result. It goes, wait, I'm awful, I can't handle the problems in the world. Our stress rises, and our dopamine, which we need to focus, and in ADD we have problems with dopamine regulation, and that's our chemical that helps us focus. The dopamine drops as the cortisol goes up. So we want another thought process instead. When we see something go, wow, that looks really hard, we want to think something a bit more like, wow, this obstacle, you know, is harder than most I've encountered. You know, it'll take a lot of resources to master, and then asking yourself, do I want to master those resources? You know, is this thing that I'm not getting right now, is it worth it for me to get right? If it is, great. What are the steps I need to do? Who do I need to talk to? What skills do I have to build? If not, okay, good, like new project. Nowhere is necessary this whole process of, oh my God, I'm a loser, what am I even thinking? So that's just one of the big things in CBT. So that was before the monitoring and changing thought processes. Now we're looking at, this slide is monitoring and changing behaviors. So there's two parts to that. That's a big part, like that CBT is all about. One is called the chain analysis, and I'll show you an example of this. Chain analysis is you break down into tiny little steps everything that happens when something undesirable occurs in your world, or when you act in a way that you don't really like. So for example, here I wrote here, what usually happens in steps when I get mad at my wife. So this is actually a pretty common thing that I work with in my private practice, especially for males. It can be really hard to regulate anger and stronger emotions with ADD. In women, a lot of times it's more likely to be anxiety that is hard to regulate. So for one of my clients, this is exactly what his chain analysis looked like. So first, his wife rushes, you know, him out the door. Then he starts to feel really stressed. Step two, he can't find things, of course, because I don't know. I experience this myself. Like if I'm running out the house and someone's trying to push me out, I'm like, oh my God, I just can't even see anything anymore. It's all just a big cloud of misery. Then next is I start to breathe heavily and my hands clench. And so that's physiologically what's happening to him. Next thing, he goes back to his mind and he goes, I can't think properly, and everything she does annoys me. And then the next step goes to, I yell at her to shut up, then she yells back at me and we fight. So I love using examples in relationships because I do a lot of work with people with ADD within the relationship context or within their marriages. And what tends to happen is, like every time that person will get angry, it's usually going to be a similar series of these steps, maybe with a different stimuli that it starts with, but it will usually tend to kind of look like these steps. Everyone seems to have a pattern that they follow, so this is just one of his. And so the second part, so we want to watch the chain analysis and go, okay, that's what's happening for me. That's a big thing that a therapist will help you with, or what will help you with in the CBT groups. And then we go to the changing the behavior pattern. So this is, you try to decide the when, what, testing, practicing, and assessing. So the kind of those 5 categories I created there. So you're looking at the chain and going, okay, these are all the steps. The next thing you have to do then is decide at which step you will change the behavior. So here's an example of that. So these are the same steps that male, that kind of husband goes through with his wife. And I put in blue all the possible times when he could have changed his behavior. We ended up actually choosing for this client the before time. And so like the first one over there that says before, plan with wife for different ways of leaving the house in the future. But these give you examples that within your chain analysis, there are so many times that you can choose to take another step. So feel free to kind of check that out. The PowerPoint will be available later, whatever. Zoe will tell us about that. Anyway, so we want to look at the when. So when is it happening? That you're going to be changing it. What are you changing the behavior to? Then you have to try it out, to try out the new behavior and see how it goes. Then get into like practicing it. So now you're like not just trying it. Okay, is it possible? Okay, yes, it's possible. Now it becomes realizing that, okay, unless I practice it so much, I won't even know if it's going to work. And just a quick neurological reason for this is that every time you try to do a new activity from something that is almost instinctual to do in the first place, so you're taking a new path, it's exactly like when you're in a forest. So in a forest, if you've gone down one path lots of times, grass stops growing there, and things will just, it becomes really easy to go down that path. And if the path, so you start with, say, when your wife rushes you, and the end of that familiar path is you and your wife fighting, that might not be a path you want to keep, even though it's the easiest. In order to create a new path, you've got to kind of essentially grab your machete and chop your way through the forest till you get to the new behavior, which could be, every time I start to get mad, take a lot of deep breaths. That was one of the suggestions here we put. So focus on deep breathing and calm down. Or another time he could keep everything he needs, and like when he leaves the house, in one place or whatever. It's just creating a new behavior. And that analogy of the forest is exactly what happens in your brain. We have something called synapses between kind of thought. This is how thoughts fire or happen. We have one thought and usually will directly take a path to another thought. And it takes a while to kill off that one path to create a new path in our brain, and that's called neuroplasticity. So eventually it becomes much, much, much easier to do these patterns and be forced. That's why practice is a huge step. Before you even know if it's going to work or not, you have to practice it for a while to see if it works. And lastly, we're going to assess, so analyzing and replanning, how did it go, what can we do better. Anyway, so that's kind of what I wanted to mention around what is CBT. So we went over monitoring and changing our thoughts and monitoring and changing our behaviors. So now we're going to move to where do groups fit into your treatment approach? There's, and what they found, through research, and I'll be mentioning research pretty soon, but for one, it can be a total standalone treatment. I mean, I have some clients who really just come to groups, and that's all they do. And later on in this presentation, I've got some really cool stories as to what's happened to some of those people who just come to the groups. But ideally, research has shown that, the best treatment for people with ADD is like a multitude of things, at least 2 things. So maybe you can do, go to groups and see an ADD coach one-on-one, or go to groups and try the medications for ADD, or go to groups and try just therapy, best if the therapist has experience with ADD, but just any therapy can be great, or groups plus diet and supplementation. So that's very similar to medication. A lot of diet and supplementation tips can give you the help and the focus you need to start using and trying the techniques within the groups that you're learning. So it really works together very well. Okay, now let's go into some research. So there's been several studies. I mean, these are just a few of them, and so you'll see the colors of the kind of name are correlated to this area over here. So the Wylans et al. Study, I don't know if I'm saying that right, correlates to these results, and the purple one correlates to purple. Anyway, so we had several studies. So Wylans et al., what they found in 1999, just in the kind of beginning of studying these things, that they were definitely finding, wow, groups and adding CBT to groups, especially for people with ADD, was starting to decrease disorganization, inattention, and increasing emotional stability. I could have actually written increasing emotional stability. It kind of looks like it makes you crazier, but no. Emotional stability does go up. I'll change that in the slides. Next, we have Hesslinger et al., and what they found in their study of kind of ADD within the group context, bringing in elements of CBT, is overall personal health went up, scores on the Beck depression inventory went down, and it improved their selective and split attention. So selective and split attention are kind of when you're focusing on one thing or when you're trying to multitask. It just improved all those things. Then Safran et al., they're the ones who he wrote a really good other book on CBT groups for ADD groups. Just look him up. I don't remember the actual book's name, but anyway, his study in 2005 was pretty huge. They found that improved depression, anxiety, and global functioning, so everything in a person with ADD's life was getting better after they were part of these groups. And then there's a more recent study is Solanto et al., and they ran a pretty awesome study. I think it was like a 12 to 15-week format, so it was one of the longer studies that was tried here. Some of these were kind of shorter, maybe 4-session ones. But so Solanto, they found that it led to a decrease in inattentive symptoms, increases in time management, organization, and planning skills. So there's definitely a lot going on at the groups. And So some common topics that we're tackling at the groups, which may explain why, some of those awesome kind of research results are happening, is that we're going right to the source of the issues that people with ADD in particular have. So these issues are very commonly procrastination, starting projects, finishing projects, medication options, exploring alternative treatment options, diet and ADHD, sleep optimization, money management, that's a really common one, emotional regulation, organizing tasks, communicating needs, resolving romantic conflicts. These are ones where, as I mentioned before, in my CBT for ADD group, we tend to do vote-offs for what we're going to tackle this session. And so these are just ones that very often the group tends to vote on wanting to solve. And just another thing, what is a value that groups bring? So it's knowing that others, these are things that people have told me about the group, but also things I even experienced by running the groups. And so it's knowing that others are really going through the same thing as you are. I mean, it can be so incredibly alienating to be like, oh my God, I was at work and my boss was telling me what to do, and after the first thing he said, I totally blanked out. I have no idea what he said, and now I'm trying to do a project and I did a horrible job, because I couldn't ask questions or because everyone else seemed to be fine with the instructions. So coming to the groups really makes you feel like, wow, okay, this isn't so bad, and everyone else faces this too, and it's a real thing. It's not just me being lazy. Another big thing is that you get to see a variety of techniques. So sometimes I do a lot of one-on-one counseling and coaching for ADD, and sometimes it can be tricky to show as much of a plethora of techniques because we'll try them for quite some time together. But when I get my clients to come out to my groups as well as the one-on-one work, they get to see a bunch of techniques, and then they get to tell me, hey, Alina, I really like this one. Can we bring that into my kind of treatment plan or whatever? And I'll be like, awesome, thank you for giving me that direction. And also if you're seeing a therapist or even someone non-specialized with ADD, coming out to groups can be really useful because you can get all the kind of specialized ideas and come back to your therapist and go, okay, this is the help that I really need. Can you please, give me that? Next point is it helps you watch people go through similar struggles. And that is a huge thing because it helps you gain self-empathy. So first, it's just nice knowing other people have similar issues. But the second thing is when you see somebody across the room, crying because they were called stupid or crying because, they are always late and they can't control it, all you want to feel for them is, oh my God, I totally feel what you're going through. It's so awful that happened. And unfortunately, it's very rare for us to look at ourselves when we go, wow, I'm really sad about this. It's pretty rare for us to go, well, of course I'm sad. This is a really sad situation. I should be sad. I deserve to be sad. But luckily in the groups, a huge part of the therapeutic value of the groups is seeing that person crying or sad, and you go, oh, okay, I can be sad about my stuff too, and I can cut myself some slack, and I can be kind to myself, because so often we can be kinder to others than ourselves. So that's a nice way to generate self-empathy. And lastly, for an affordable rate, you get to have about 4 to 6 times as much as of therapy for the same price. So, for example, my groups are extraordinarily low priced. I just want to make them really affordable because I used to run the groups for free, and I love them so much that I didn't want to make them too unaffordable to people, especially because people with ADD tend to, on average, have lower incomes just because it's harder for us to kind of keep or get jobs or whatever, and we're a bit more misunderstood. So for my groups, the cost is about $12 per session. That may at some point change. For the CBT groups versus support groups are free. And just a heads up for everybody out there, very commonly support groups will be totally free if it's called support groups for ADD. And I'll tell you how to find ones in your area pretty soon in the presentation, but generally those are free. The support groups are free, and usually if you're going for more of a therapy group, it's going to have a cost. The average cost is probably $25 to $30 per session. And so yeah, so really, but it will depend on every area. As I mentioned, mine are $12 per session. Versus, say, seeing an ADD coach one-on-one, rates are something like anything from for a coach, anything from $75 to $120 an hour, really. So you kind of get a lot more bang for your buck, but I, again, suggest trying a couple of different things, like just the groups might not always be enough. Anyway, I'm going to stop right now just to pause for if we have any questions. Zoe, feel free to bring that back and
Sure.
make that happen.
Okay, so can you hear me, Alina? You can hear me? Yes?
Mm-hmm.
Oh, good.
Yeah.
Okay. Yes, we have some questions coming in. Let's see. Okay, so many comments. Okay. Oh, yes. One of our participants was wondering what the name of the book was again that you mentioned. Could you tell us the name of the book
definitely.
again?
A really great book is A Cognitive Behavioral Therapy for Adult ADHD, and it's an integrative psychosocial and medical approach. It's kind of like the subscript, and that's by Russell Ramsey and Anthony L. Rothstein. And again, the book is called Cognitive Behavioral Therapy for Adult ADD. Mm-hmm.
Great. And Alina, I'm sorry, did you have that on a slide? Was it listed on one of the slides?
No.
No. Okay, well, that's all right. I'll tell you what, everybody. What I'll do is in the description of the YouTube video that will be posted after tonight's session, please do look at the description of the webinar, and I'll have live links there that you can click on, and I'll have references and some resources for you so that you can find those after our session and not worry, about jotting things down now. We'll make sure that I'll get Alina to send those in, okay?
Awesome.
So, good. Now we have another question. We have someone asking, have you tried or are you aware of any studies using, quote, third wave / metacognitive CBT?
No, that's interesting. So third wave metacognitive CBT, it might be part of some of the studies I was reading without, like maybe they're calling it something a bit different. But I know there's a lot of different ways to run the CBT groups, and all the studies try a mildly different format. So yeah, sorry, nothing comes to mind to me about that.
Okay, thanks. Now, here's another one. When do cognitive distortions become maladaptive? Are cognitive distortions healthy to a degree?
Let's see. When you're younger, they're life or death. They're very important. Like if you never make the baseball team because you're too uncoordinated or whatever, or just because you can't get there on time for the audition, yes, that happened to me. You have to start telling yourself something that goes, that keeps you from constantly getting disappointed, and that lie might be, well, you'll never get anything, so stop trying. And so I was like, oh, phew, good, nothing to do here. I don't have to try. And so temporarily it can be really useful. It's over time, cognitive distortions become problems when they get in the way of you actually getting your goals achieved. So if it's something like, wow, I really hate my job right now, and I want to get a new job I love, but then you have a cognitive distortion that tries to talk you into submission, like, no, don't try anything, that's really, you've gotten to maladaptive place. It's going to hold you back, and that's something that's really important to look at because oftentimes the biggest people standing in our way of achieving things are ourselves. So yeah, that's
one great
guideline.
Thanks, Alina. We have so many questions coming in. Isn't she great, guys? All right, sorry. I'm very enthusiastic about Alina's work. I really am. She's helped me for sure. So here's another one. For the example, with the wife and the husband taking preemptive steps to change the end result might decrease incidences of fighting, but does this attempt to correct negative thought patterns or the anxiety / ADHD symptoms? While the husband and wife may not fight because the keys are closer to the door, the husband may be experiencing the same thought patterns just without a stimuli to provoke a certain kind of behavior.
True, and that's why, let me go back to that slide, and by the way, there's another 20 minutes of presentation, so I might cover some of those things, but in terms of the thoughts that he's thinking, that's under the monitoring and changing behaviors. We'll totally be tackling that. Monitoring and changing thoughts. So we'll totally be tackling that first as well, like, okay, what do you think of things, what's happening? And then once we're like, okay, so now we know what your thought processes are, what are your behaviors? And where are things getting in the way? And then when we go here and we're like, okay, where can we change things? there's kind of a variety of different options, like, you know, noticing after step 4, we're noticing that your thoughts aren't going to be helpful at this point, so we're remaining silent until we have a chance to actually talk through what we're thinking or changing our thinking styles. But yeah, I totally agree. It's really important to look at, like, why is the husband having these thinking styles, like what's happening here, as well as actually changing the behavior that he has towards his wife.
Okay, great. Thank you. All right, we have so many more questions. Okay, are groups open-ended or time-specific?
It really depends. My group is an hour long, but yeah, usually it'll be like a certain amount of time, like mine's every Thursday from 7 to 8 p.m. Eastern Standard Time in Guelph, and that's how long it is. When I used to run groups, when I was just starting things off with these kind of groups, again, they went from 1 hour to 4 hours. Well, I don't know, I was like a bar. Whenever people went home, that's when I closed. But it was very amusing. Yeah, it was better once we actually got a format, because then I could make sure that we had time to get in what we needed, that people weren't leaving halfway through the group thinking, oh, this is all there is, when we were going to get to the good stuff later on. So I think an hour to 2 hours is a really good amount of time for the groups. Otherwise, I mean, what ADDers can sit that long, really?
Yeah. And it's also respectful of your time and energy as well.
Yeah.
Another question, what types, oh, I love this one, and I have to say I've experienced Alina's group, and I wish I could go every week, but I live too far away. What types of homework do you give adults in your ADHD groups?
Let's see. In the current drop-in group that I work with, I don't actually give the adults any homework. That'd be fun, though. I'd be like, all right, I think you need to do this, but no. Instead, what it is I'll ask every member of the group, like, you know, do you want to create a homework item? And they can say pass, so no. Or if they do want to do something, really common ones are things like, okay, I want to do clean 20% of my basement, or I want to, you know, go and Google the 5 love languages and take a test and figure out which one me and my wife are, or I want to start using timers when I try to do chunks of time or something. So I usually only let them do one goal a week, and I usually make them quantify it as much as humanly possible. It's not just, I'm going to try to be happier. I'm like, oh, tough. I'll try again. Yeah.
Alina, I'm just going to jump in here and say I'm aware of the time, and I think because this particular session, I think we have to have you back, obviously. Yay. And this rented lips. This session is definitely going to focus on CBT, and I think you gave us some good examples there. So I'm going to move on to the next question, which is, and then we'll have to wrap it up and leave.
Yeah, and go back to the rest of the presentation.
Yeah. Perfect. So I find identifying and modifying cognitions hard work, and I don't think I have ADHD. Do you find the cognitive bit is harder for clients than the behavioral techniques?
Cool question. I'd say probably really depends. I think, actually, a lot of times I think the cognitive bit is a little easier than the behavioral stuff, and only because we really get a lot of time to think about, okay, how do we want to think about this differently? And sometimes we give them techniques like they use an elastic band every time they use the wrong cognitive thought. But it's just really hard in the moment to choose that, like, okay, do I yell back at my wife, or do I choose to physically do something different? It's like with your thoughts, it takes maybe a little bit less energy to change than some of your behaviors. That it's like a physical, like muscle memory almost. So I don't know. I think everybody's different, but for me, I think behaviors are a little harder than cognitions.
Okay. Yeah, I guess we all are different. Here's another one. Do you initiate a self-rating scale to help clients with seeing their success?
Yes. Actually, I totally forgot to put that in the presentation, but this is important, and this is the last question before we go back to the thing, just by the way. Yes, we use something called the, where is it? I'm actually in my office right now. It's called the Outcome Rating Scale. It was created by Miller, and what it is we get people to rate themselves on 4 target areas. There's individually, how they're doing, so their personal well-being; interpersonally, so family and close relationships; socially, work, school, and friendships; and overall general sense of well-being. And then I actually use a website called My Outcomes to graph the results of kind of the improvements of clients. And so right now we're actually gathering a lot of research to show how the CBT groups are helping people, and over time we'll have our own little study and book or whatever probably coming out about it. But yes, we very much document results, and results tend to go in a very good direction.
Great. Okay, thanks a lot. So 7:34, we're doing well for time, I think. And yeah, hopefully we can get through the rest of the presentation and absorb it. You're giving us a lot. So I will be quiet now and throw it back over to you, Alina. Thank you so much.
Thank you. Okay, so I'll go maybe for another 15 minutes, and then we'll stop again for questions. Is that right? I'll take your silence as a yes.
Sounds good.
Okay, so going back, yes, perfect. Okay, so going back to, okay, so I wanted to go into some success stories of some past group members, and I'm not going to use any kind of particular names or details, just because I didn't get a chance to ask them yet, but I'm sure they would have loved to share their stories because they have some cool stories. So first there's a person, he started coming about a year ago, and at first when he came, he was definitely a very motivated person. I mean, his marriage wasn't doing so great. His job, he didn't really like his job in sales, and it wasn't phenomenal for him, like kind of, and his ADD was really overwhelming him and causing a lot of problems just in his communications with friends and just in getting anything done. So self-esteem was pretty low. Things weren't going so great, according to him. And he started coming to the group about a year ago, and he religiously came every single week, even though the way I run my groups is a drop-in group. He came like every single week. And over time, he started noticing the self-talk. That was one of the strongest things for him to notice, like just realizing that the way he was talking to himself was really so much meaner than the way he talked to anybody else, and he just never cut himself any slack. And he started understanding why he was having problems in his relationships, and why, you know, he wasn't selling things as well, where maybe he was alienating his clients. And so now, about a year later, he's totally changed everything. He lost, like, I think it was like 30 pounds and kind of built all like muscle. And also, like, he became the top salesperson in his company. And what else? They did end up kind of separating from his wife, and they're kind of going through a process. But he's now really relearning that him and his partner had a really codependent relationship where it maybe wasn't like his ADD made him so reliant on her that at this point, as he was becoming more independent, it was causing a lot more problems. So, you know, so for him, it was really a huge success story, even though everything wasn't, you know, perfect on the outside, like, you know, with the marriage not particularly thriving, but that allows him to also go in the direction of finding a partner that really supports his ADD and that kind of thing. So that's just one really cool story. And the second one is Michelle. She's been coming to our group, I think she started about 2 years ago, so she first started coming to the support group, and then now she's transitioned to the CBT group. And so she's a grandmother, and she learned about her ADD, I think when she was like 72 or 73 or something. And so she was just feeling like really low self-esteem, really high anxiety, and you know, she had grown these two really strong independent women, and she just couldn't understand like why, what was getting in her way of really being able to be independent and all those awesome things. And then she started coming to the groups, and she started, like, for her the biggest thing was understanding why she had low self-esteem, understanding why it took her longer to do things, and giving herself that compassion to do things a little slower. And then her daughter was also diagnosed with ADD, and they can kind of come to the groups together. And just now she's creating especially a lot of boundaries in her life. That was one of the biggest things that the groups were helpful to her for. Before, she'd always just try to please everyone and do as many things for people as she could, that she would never make any time for herself, for her routines that she needed to be happy, for the things, the self-care she needed to grow her business or anything she was doing. So now she told me the other week she came to the group and she said, you know, like, I came to this group even though I had family coming and they came from out of town, I still came just because I made a promise to myself that, you know, I'm going to set boundaries, and I told them, you know, weeks before that this is what I was going to do. And so she's just really making space in her life to make that work. Anyway, so I just thought that was super cool. And there's a lot more stories like that, but I'll just keep going. Then we go into what the most effective groups look like. And honestly, I can't tell you perfectly. The research is still in its infancy. There's still so much we need to learn around what formats required. But something I learned is definitely having enough structure to keep things on track. If you're dealing with adults with ADD, you're going to be thinking you're talking about procrastination, then you're going to be talking about the color of the walls, and you're going to be talking about your pet, Charlie, and then you're going to be talking about how that reminds you of your third grade teacher. And so it's really good to have a facilitator who can, give really kind comments like, that they want to hear what you're saying, but just remind you gently to come back to the topic if you've lost your way. And over time, that can actually be a treatment unto itself, or a really important thing unto itself, because then you're starting to learn, oh, this is how I get distracted, because in this kind environment where we can kind of explore, it's not so shameful to get distracted. And when we look at things that we're doing that we don't want to be doing in a compassionate way versus a shameful way, we're really able to make space to find the solutions and to change that and to make it a conscious process instead of totally ignoring it and being like, oh crap, I'm bad at this and I don't want to think about it. So yeah, having a good facilitator to be able to keep things on track, make sure we get through all the things we need to in the group, but still, being compassionate, not cutting people off or shaming anyone. Another part is an accountability piece. So as I mentioned at our CBT for ADD groups, something I found ridiculously useful was having a homework item or a goal between sessions every time. And that just means that the person knows they can do whatever they want, but that by next week, we're going to ask them about this thing. And the concept here is not to shame them if they didn't do it. It's more just about bringing awareness of, okay, through trying to do this goal, what went wrong? What got in the way? Why didn't it happen? Maybe how did you word it in a way that wasn't useful to you? So it really helps us understand not just achieving our goals, but how do we even make our own goals, and where are we going wrong with this? In ADD, it's very common that we make goals that aren't so great. For anyone out there, I don't have a slide for this, but if you want, Google smarter goals or SMART goals, S-M-A-R-T, and every word in SMART, every letter in SMART is a word. Essentially, I think it's an anagram or something. Anyway, what it is it's all about making goals specific, quantifiable, so measurable, like active, so actually something you're doing in the world that you can actually tell if you've done it or not, something that you can really check and recheck if it's actually happening, and monitor. So yeah. Next thing, ideally, to have the groups about 12 to 15 weeks long. I mean, if you're going to have a non-drop-in group, I think you really need quite a bit of time within the groups. 12 to 15 weeks can be great, just because it gives you time to really build a lot of rapport in the group. It lets you deal with so many of the areas ADD touches. I mean, it's not just like, we're not just trying to help you get to a goal or get through one thing. ADD impacts our time management abilities, prioritization skills, organizational skills, impacts our emotional regulation and our anger and all our emotions. It impacts everything in our lives. So we need to tackle money management. We need to tackle how do we start projects, how do we finish projects, how do we deal with different emotions like anger or self-hatred, and learning those cognitive distortions takes quite some time, and creating new thought processes. So, a longer time is better, or if you can find a drop-in group, that's great, because then you can just kind of keep coming whenever you need help. I'd suggest, though, coming straight for about 12 to 15 weeks at least to start really getting that part of your self-talk cycle. Another thing that is really effective in groups is the chance to discuss problems as well as solutions. Like sometimes, I mean, it can really go both ways. I've been to some ADD support groups or there's no other CBT for ADD groups around here, but I've been to some ADD support groups where they'll just focus on what the problem is, and they'll just spend the whole time talking about the problem, and other groups where they'll just talk about solutions. And I find that both are a little lacking, because everyone experiences the problem differently, and everyone experiences solutions differently. So if you haven't taken much time to explore the problem and you're giving someone solutions to procrastination, your solutions to procrastination may look totally different than what they think procrastination is. Like I had one client where his version of procrastination was, he wouldn't start things for 3 days, and another client where his version of procrastination is that when he actually started things, he couldn't focus on them. So we all just have different interpretations. And another part is ideally have it led by a specialist in ADD, ideally even with a specialist who has experience with their own ADD. And I say this because like I've had my group, the CBT for ADD group, I've had it run by a couple of different therapists. I've had to go on vacation sometimes, and I've left my baby, aka my group, with others very hesitantly. And I did get the feedback that when people were running the group who didn't have ADD, that the group was a lot more closed. They weren't sharing as much, and that it wasn't as helpful to everyone. But they found that whenever it was me or other facilitators that had ADD running the group, they were able to really feel heard and understood, and the solutions were a lot more accurate when we got to them. Yeah, and also so that you're it's good to have a specialist leading the group in ADD, just because instead of just talking about, hey, this worked for me, the specialist can go, hey, this is what the research shows, and this is, even though the research shows this, this is where it went wrong for all my clients, or this is the strategy that's actually better than the research when you actually apply it in real life. So they can kind of give you some perspective. And then we go into how do we find groups that are nearby. So we want to be able to find there's a couple of different options. We're in different countries, I'm sure. I'm here in Canada, in Guelph, Ontario. It's very cold. There was a snowstorm outside. But the best way to do it wherever you are is just to go to Google. And good terms to Google are things like ADHD group and then your town name. So ADHD group Guelph or ADHD group Sacramento, I don't know, San Diego or whatever. I want to be in San Diego right now. That's why it came to mind. Or ADHD support groups, and then the town name. You could even try to put in a CBT for ADD groups, but again, they're really not that common. I may eventually start one online, but yeah, for now, you could possibly create your own. Another place is seek resources, resource sites such as CADEC, so that's CADEC.ca. In Canada, there's CHAD, chad.org, and I think that's American as well. Then there's totallyadd.com. There's a lot of really cool resources there. There's a lot of places to look, but your first place is just that Google search. And another place I didn't put on there, but meetup.com. So it's meetup.com, meetup.com. And what it is, like I have our group advertised on there, but it's just a bunch of special interest groups that people can share kind of all over the world, and oftentimes ADD groups are seen there, possibly run by someone with ADD or by a specialist. And I guess just to start closing the group, this session right now, I'm going to facilitator mode. But some further resources on the website, I have the info for our groups in Guelph, Ontario, Canada. So we run the CBT for ADD group every Thursday from 7 to 8 p.m. But obviously that's too far for a lot of people. But we also run our support groups once a month from 6 to 7 p.m. And once a month is really a common amount of time to have support groups run. Sometimes you'll get lucky and it'll be once every 2 weeks. But usually once a month is pretty common. We also have the blog and podcast. So as I mentioned, or as Zoe mentioned, I have a radio show called Strange Brains Talk Radio, all about ADHD and Asperger's, and you can hear the podcast just at that link on Read and Listen. We've got a really active Facebook group. That's a really great place where people all over the world can post, post messages or post comments, communicate with one another. I usually post a lot of research on there about ADD. And just my experiences living life as a therapist with ADD and mild Asperger's. And then there's the website, again, a lot of resources, and you can email me at that, Alina at Guelph Counseling Center, where I work here in Guelph. And yes, so Zoe, if you can start bringing things up, we'll do more questions again. And thank you so much for listening to me, guys.
Oh, that was fantastic. Thanks, Alina. We do have tons of questions. So let's see. Okay, we have a bit of time. So let's get into the first question is, can this be used for children between 8 and 12 years old?
Definitely. My specialization is in adults, so I predominantly work with adults, and my youngest person I work with is 12 years old. But any kind of group format, especially for kids, can be really, really useful because the kids, they need to have the social environment that's telling them that they're okay, because they might go home and everyone's like, why aren't you trying hard enough? And they don't have any good ways to defend themselves. They're not like, well, recent research shows, or, and at school, the teachers may be, not getting along well, giving them a good environment. So groups for kids are fantastic to put, really, really good to put your kids into around the ADD as early as humanly possible to help their self-esteem stay strong.
Alina, that brings to mind another webinar I did with Lisa Arrow, who's got a blog called Queen of the Distracted. She has a bunch of kids with ADHD, and she does a lot of work around teaching her children to self-advocate, and she does advocating for them too when she needs to in the schools. So to continue on to this question, when you're having your child in a group format and helping them bolster their self-esteem, etc., how would it be important to have the parents also pick up on those skills to back up what they're learning in the home?
Oh my God, yes. Yes, you can teach, from what I think I heard, because my ADD may have flared out, but but I think you were saying if they're learning it at school, should they be learning it at home too? Is that correct?
No, the CBT groups for kids, I think it's great that they can go there. As you said, they don't have another thing to fall back on when they're being teased, but if they go to a group and it's effective and then they go home, and some parents frankly undermine that.
Totally. Yeah. If you're a parent, or if you know of other parents who are possibly driving their kid crazy by doing this, parents can also go to, there's parents and caregiver support groups for people with ADD that often exist as well. We have one in Kitchener here near Guelph, but also just if you Google it, so like parent support for ADD or whatever, and then your town's name, that could be a really good way to get some more resources, because yes, you can teach a child this is the right way to do things. Believe in yourself, you're awesome, but then if they go home and they're being told that they're lazy and they're not getting anything done, and it's because they're doing it on purpose, then their brain's going to break again, and all the cognitive distortions are still going to be there.
Right. Okay, thanks. I just wanted to bring in that family piece. Okay, so we have lots more questions. Dual diagnosis, connectedness, and implications of ADHD Asperger's, impact of treatment success. Comments?
Yes. I will answer that. I'll make it into a question in my head. Okay, so yes, oftentimes people who come to my ADD group have been currently addicted to drugs, have had depression, bipolar. Asperger's is really common, to the point where the group is actually for ADD and Asperger's, because we have such needs that are very, 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 very similar to one another, but people with ADD and Asperger's. You know, it's going to get in the way if your symptoms are disruptive in a group environment. So, for example, if you have Asperger's and you easily take things literally, and maybe you're going to get really mad or just correct people or say that your question wasn't answered very well multiple times, or whatever can happen with the rigid thinking structures in Asperger's, that may possibly get in the way sometimes. Or if your ADD is so bad or so intense, I guess, that you can't listen to a whole sentence without interrupting in the middle, then that can cause problems. But one thing that we do bring in to try to prevent these things is I make sure everyone has a paper and a notepad, or paper and a pen, to write down their thoughts during groups. And I warn everyone in advance, like, you're going to want to interrupt each other, write things down, and that can help. But yeah, so dual diagnosis, totally fine, but just in case it might get in the way of the group process, that's all.
Wow, great answer. Okay, can the leader be a coach specializing in ADHD? Does the leader have to be a psychologist?
Oh my God, they definitely don't have to be a psychologist. A psychologist, I mean, honestly, I didn't understand how the psychology world worked until I got into it, but there's different levels of mental health practitioners. So a psychologist is a person usually who has a PhD in psychology, and the research totally supports that people at the master's level or even the bachelor's level can be ridiculously effective, especially as facilitators of groups. So yeah, if the group leader is an ADD coach, that's fantastic. If they're a psychotherapist, that's great. A psychologist, even a psychiatrist, just be careful that they're not leaning too much on medication alternatives. Medication can be something that's fine with the groups, but really the groups are all about the cognitive behavioral strategies and approaches, and myself, I don't use medication, so I try to get clients, if possible, to do as much as we can before we have to get onto the medications. But yeah, sorry, I don't know if I went off on tangent there.
That's okay. Actually, we have a question coming up about tangents in a moment.
Yay.
Oh, and here it is. Great segue. How do you go about handling clients in group therapy settings who may talk in tangents and are becoming a potential threat to others' experience without shaming? And I think you did speak to this a little earlier, but there's the question.
Yeah, that's a really fun question. I've tried lots of fun things around this. One time, I used to have a co-facilitator at the support groups a couple of years ago, and he was a social worker with, and social workers are great people to run these groups too. Anyway, so he was a social worker with Asperger's and ADD. We were very complimentary with one another. Anyway, but what he would do is he would go on really long tangents, and but me and him made a deal, like out of session, I talked to him, and this is what I've actually done with members of the group as well. I'll talk to them and be like, okay, so what I'm noticing is that it might be getting in the way of the people in the group, and likely the person will say, I know, tangents are the bane of my existence, I don't know what to do. And what we created is like certain symbols during group. so with one person, we created that whenever they'd see that my toes would touch each other. This is the weirdest subtle. He asked for this, but he wanted me to make my feet touch each other, and if they were touching each other, he knew he had to shut up if he was talking, or just start winding down. Or another person wanted me to make a timeout symbol and say the words airtime to remind him in the middle of him talking, and I was like, okay, so you want me to interrupt you? Great, so that's going to be hard. No, it won't. Interrupting. Anyway, yeah, so you can talk to the people outside of the group. That can really help. Or, again, remind them to be like, you could say something like, that's a really great point. Hopefully it's actually a good point. Or like, wow, that's something I need to think about, or thanks for bringing that up. Could you just write that down, like the rest of your thoughts about this, so we could hear from everyone else and what they think about what you just said? Or just a quick notice about, hey, sorry, time is a bit tight. We have to rush what you're saying. Can you please just repeat that a bit more concisely? And sometimes we even have topics where we will discuss conciseness in ADD because it's such a common problem we all suffer from.
Great, great. Okay. Here's another one. ADHD is primarily viewed from the diagnostic medical model. Do you feel that the systemic causes are overlooked by the therapeutic community? And I'm not really sure what he means by systemic causes. Do you want the person to clarify that, or?
Yes,
yeah.
please.
Okay, so I'm going to ask the person who wrote that question if they could please clarify what systemic causes you're referring to. That would be great. And we'll move on to the next question in the meantime and then try to get back to you. So the next one is, this is a bit unrelated, but I'm interested in codependent relationships. What are some of the hallmarks of codependency, and what disorders are they correlated with, if any? Now, Alina, if you feel comfortable tying that in with CBT, great. We have people who want you to come back. I want you to come back, so we can do another one if you want, or if you want to address that now.
I could really quickly, I'll just put it in, that codependence is around when someone hurts you repeatedly, but you choose to stay in the relationship because they give you so many things. I mean, it could work if you find ways to create boundaries with yourself, that kind of thing. But if you're in a relationship where, say, you start walking on eggshells, where they can get kind of mad at you really randomly, or you find yourself thinking things like, okay, last time they told me to bring it up really softly, and I bring it up softly 5 times, and yet every time they still got mad, how am I supposed to bring it up softly? I would ask them, but they'll yell at me about it. This is one kind of codependent relationship I've seen very often. So where you feel like you can't exist without that person, but that person also causes you a lot of harm and self-esteem problems. So that's where there's an end. At the end of the day, it's causing taking away energy than giving it.
Okay. All right. So I'm still looking for a clarification on systemic causes. So we'll take the next question. Thank you. Alina, I am an undergraduate student currently applying to, I think it's a doctorate program in psychology and several master's programs in psychology. What is your educational background, and do you have any advice for someone less interested in research and aiming to be a practitioner, hopefully in private practice?
Sorry, that's a good question. There's so much there. I'll just really quickly toss out that going for there's now a new thing. Instead of a PhD in psychology, you can get a different kind of PhD like a PhD in psychology instead of PhD in philosophy of psychology. So it becomes a PsyD. So it's spelled PSY.D. And so that's a doctorate in psychology that's very much more applied, so that you're not having to do all the research-based stuff, and that's a really great launching point. I personally have gone in the direction of Masters in Counseling Psychology, as well as training in advanced ADHD coaching, and I also have a background in neurolinguistic programming, and I'm also a yoga teacher. So I've really taken it from a lot of different angles, because all these things have been very helpful towards my own treatment process. Yes, I'll leave that there. Next question.
Fabulous. Okay, we've got some specifications now for systemic causes, so I'll read the whole thing again. Awesome. ADHD is primarily viewed from the diagnostic medical model. Do you feel the systemic causes are overlooked by the therapeutic community, and what they're referring to is disorganized home, lack of parenting skills, etc.?
Okay, so they're saying, are those things overlooked by the community? I think so, if I'm understanding the question right. I think that, yes, oftentimes the medical model will say, oh, you're unhappy, take these uppers, take Prozac, or oh, you're late all the time, we should make you focus so that you stay focused. But what they're finding is more and more, a lot of it is really behavioral, because you really have to look at, okay, are you unhappy because you hate your job, and maybe do you hate your job because you have learned helplessness and you don't know how to find another one, or because you think you're bad at everything because you have low self-esteem, or I think it's usually such a huge collaboration of what creates a problem that I have to explain to this at length to my new clients, because they're like, okay, I'm having trouble studying for school, help me study better. I'm like, great, we'll probably have to address how you're eating, how you're sleeping, what your relationship is to your roommates, how you feel about the homework, why you felt helpless doing homework 10 years ago. All these things can sometimes go into creating the best approach that isn't just a Band-Aid solution. And yeah, sometimes the medical model isn't so vigilant of that. I agree.
Right. Okay. Fantastic. Wow. Okay, we're going to have to wrap up, but wow, that was amazing. Alina, I'm going to ask you while I'm chatting here to please change the screen back over to me, or I could just do
right.
it, but
I have to remember how to do that.
There we go. So in the meantime, I want to thank everybody. I think I can do it, Alina.
Please do it.
Okay. Yes, I want to thank everybody for coming. We're going to do a little bit of a wrap up. Okay. So just give me one second here. All right, so just a couple of housekeeping reminders before we wrap up. I'd like to remind you that there will be a replay of tonight's webinar, thank goodness, because Alina gave us a lot to think about, at Psych Central's YouTube channel, and you can see it, hopefully. Alina, can you see my screen?
Yep.
Yeah, great. Okay, so there's our YouTube channel URL. And along with the replay, I'm going to ask Alina again, when we're finished, she'll be sending me some links, the name of the book that she mentioned, as well as some of the other great information that she mentioned, and I'll put some links on the YouTube channel video description. So I just really want to thank everyone who took the time to join us live tonight and for your fantastic questions. So Psych Central, I'd like to thank them for hosting, because they've really been generous in offering this space for our Psych Central webinars. There are lots more webinars archived when you go to the YouTube channel. And saving the best for last, Alina Kislenko, thank you so much for doing this presentation on CBT for ADHD for us, and I'm really hoping we can have you back at some point sooner rather than later.
I hope so. It's fun. Really scary and then fun.
Yeah, I agree. All right. So on behalf of PsychCentral.com and me, Zoe Kessler, and Alina, good night, everyone, and please do check out our YouTube video. Thanks for joining us. Bye.
Thank you. Bye.